Good morning, Sanjay.
Hello.
My name is Emily. I'm going to be your student nurse today, and your primary nurse is Andrew Estefan. Is it okay if I ask you a couple questions right now?
Yes.
Thank you. How are you feeling this morning?
Okay. A little weak and tired.
Yeah. It was a rough day yesterday, eh?
Yeah.
Do you have any plans for this afternoon?
I was hoping just to rest in bed, nothing specific.
Yeah, I think that's probably best for you is if you get some good bed rest.
Excellent.
So I'll come back and check on you in a bit.
Thank you.
Thank you.
Bed rest has been a prescribed form of therapy since the time of Hippocrates in 450 BC. Bed rest was popularized in healthcare in the 1860s when Dr. John Hilton recommended that if bed rest helped to heal bones, it could help heal other systems of the body. It was not until World War II that we began to see a shift away from this therapy.
Hey Emily, how's it going?
Good, I just finished my rounds.
Oh, awesome. Did you ambulate your patients yet?
Like patients? Am I actually supposed to ambulate them?
Yeah, actually research shows that early ambulation is better than prolonged bed rest.
Oh, really?
Yeah.
With prolonged bed rest, we can see a deterioration in the cardiovascular, respiratory, musculoskeletal, gastrointestinal, genitourinary, integumentary, and neurological systems. These adverse effects can be seen by day 2 in hospitalized older adults. Up to 40% of muscle strength can be lost within the first week of continuous bed rest, and this muscle weakness contributes to a higher risk for falls during hospital stay and post-discharge. Research shows there is an accelerated reduction in strength of fast-twitch muscle fibers, leading to a lower fatigue resistance capacity. Production of pro-inflammatory cytokines and reactive oxygen species, leading to muscle proteolysis and greater muscle loss. Preferential atrophy of anti-gravity muscles such as the soleus, back extensors, and quadriceps. Loss of bone tissue that produce blood cells, which also places the individual at a higher risk of fractures. These functional declines are the leading complication of hospitalization in older adults. We see it affect a person's ability to perform ADLs and IEDLs at the time of discharge and later follow-ups.
Good morning, Paula. How are you doing today?
Good morning, I'm doing okay.
Okay, my name is Julie. I'm your student nurse. I'm with your primary nurse, Andrew Estefan, today. I just have a couple quick questions to ask you first. And do you have any plans for today?
No plans. I was hoping to just stay in bed.
Okay, so I actually want to get you up and walking today. It doesn't have to be right now, but I do want to get you up a couple times. How does that sound?
I guess I could try it.
Okay, it'll be good for you. It'll help you get your strength back.
Okay, well that's good.
Ambulation reduces a patient's delirium, pain, urinary discomfort, and decreases the risk of deep vein thrombosis and pneumonia. Encouraging ambulation in hospital also decreases the time it takes for patients to return to mobilizing independently. This has positive effects on a patient's quality of life, patient experience, and their feelings of independence. In practice, we do not see patients being ambulated enough or at all. AHS has a new initiative called MOVE, Mobility of Vulnerable Elders, that promotes early ambulation of older adults during their hospital stay. Now, bed rest isn't all bad. It is still prescribed today in certain situations, like poor pain management and low oxygen saturation. For patients physically unable to ambulate due to their condition, there are alternatives that could reduce the risk associated with prolonged bed rest, like circulatory exercises and flexion and extension of the legs. However, these bed exercises are not a substitute for ambulation and will not maintain a patient's functional independence.
Hey Julie.
Hey Emily, how's it going?
Good, I just finished ambulating all my patients.
Great, how did that go?
Really well. Remember a couple weeks ago when you were telling me about the importance of ambulation? I can really see how it benefits my patients, so I just wanted to thank you.
Oh, no problem. I'm glad to hear that you can use that now.